Hey everyone, it's Dr. Crad. Living with glaucoma can be challenging. This progressive eye disease damages the optic nerve and can lead to irreversible vision loss if not well controlled. The cornerstone of glaucoma treatment is lowering the intraocular pressure or the pressure inside the eye. While eye drops have traditionally been the go-to treatment, many patients struggle with the demands of daily regimens. These drops can be costly, inconvenient, and even cause irritating side effects on the eye's surface. It's completely understandable why many find it difficult to stick to their prescribed drops, and unfortunately, this can lead to preventable vision loss. That's where minimally invasive glaucoma surgeries, MIGS, come in. There are various types of MIGS procedures. These innovative procedures are designed to safely and effectively lower IOP, or intraocular pressure, significantly reducing the risk of vision loss. A major advantage of MIGS is that they can decrease your reliance on daily eye drops, offering a welcome relief from the burden and its side effects. Increasingly, doctors are considering early around-the-clock pressure reduction therapies like MIGS or lasers like SLT, a smart first-line approach to glaucoma management. This proactive strategy aims to control pressure more consistently. Plus, MIGS procedures offer a safer alternative compared to more invasive glaucoma surgeries with fewer risks and complications. I hope you found this video helpful. Thank you so much for watching. I'll catch you on the next one. Peace.